Have you ever wondered why millions of people are living with diabetes without even realizing how dangerous it can be? What if I tell you that diabetes doesn't start with pain, it starts silently, slowly damaging your body every single day? Many people think, my sugar is a little high, it's not a big issue. But that small number can decide the future of your heart, kidneys, eyes, and even your life. Today's video is extremely important, not just for diabetics, but for anyone who eats food, lives under stress, or cares about their health. So stay till the end, because what you'll learn today can truly change your life. Diabetes is a long-term medical condition in which the level of sugar, also known as glucose, in the blood becomes higher than normal. Glucose is the main source of energy for our body and comes from the food we eat. To use this glucose properly, the body depends on a hormone called insulin, which is produced by the pancreas. Insulin works like a key, allowing sugar to move from the blood into the cells where it is used for energy. When this system does not work properly, sugar builds up in the blood, and this condition is called diabetes. There are two main types of diabetes that affect most people: type 1 diabetes and type 2 diabetes. Type 1 diabetes is an autoimmune condition. In this type, the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. As a result, the body produces little or no insulin at all. Type 1 diabetes usually develops in childhood or young adulthood, but it can occur at any age. People with type 1 diabetes must take insulin injections or use an insulin pump for the rest of their lives because their body cannot survive without insulin. Type 2 diabetes is the most common form of diabetes and is mainly related to lifestyle and genetic factors. In type 2 diabetes, the body still produces insulin, but either it does not make enough or the cells do not respond properly to insulin. This condition is known as insulin resistance. Over time, blood sugar levels rise because glucose cannot enter the cells efficiently. Type 2 diabetes often develops slowly and may go unnoticed for years, which is why many people are diagnosed only after complications begin. Diabetes does not happen overnight. It develops slowly due to multiple reasons working together. One of the biggest causes is unhealthy eating habits, especially excessive consumption of sugar, refined carbohydrates, junk food, sugary drinks, and processed foods. These foods force the pancreas to produce more and more insulin until it becomes tired and less effective. Another major cause is lack of physical activity. When we don't move our bodies, muscles stop using glucose efficiently, leading to insulin resistance. Excess body weight, especially fat around the belly, plays a huge role in increasing insulin resistance. Stress is another hidden cause that many people ignore. Chronic stress increases stress hormones like cortisol, which directly raise blood sugar levels. Poor sleep, smoking, excessive alcohol use, and family history also increase the risk of diabetes. In simple words, diabetes is the result of years of wrong lifestyle choices combined with genetic factors. Managing diabetes is not about one medicine or one diet plan. It is about consistent lifestyle changes. While type 1 diabetes requires lifelong insulin, type 2 diabetes can often be controlled and, in many cases, significantly improved through proper diet, physical activity, and healthy habits. One of the most important steps in diabetes control is food choice. What you eat directly affects your blood sugar levels. Foods diabetics should avoid or limit. People with diabetes should avoid foods that cause rapid spikes in blood sugar. These include sugar and sugary products such as sweets, chocolates, candies, soft drinks, energy drinks, and packaged fruit juices. Refined carbohydrates like white bread, white rice, bakery items, pastries, cakes, and biscuits should also be limited because they quickly convert into sugar in the body. Fried foods, fast food, and highly processed snacks increase insulin resistance and contribute to weight gain. Excessive intake of alcohol should also be avoided, as it can cause dangerous fluctuations in blood sugar levels. Foods diabetics should eat. A diabetes-friendly diet focuses on whole, natural, and nutrient-rich foods. Vegetables, especially leafy greens like spinach, Broccoli, cucumber, and bitter gourd help control blood sugar due to their high fiber content. Whole grains such as oats, brown rice, and whole wheat, when eaten in controlled portions, provide steady energy without sharp sugar spikes. Lean protein sources like eggs, fish, chicken, lentils, beans, and low-fat dairy help keep blood sugar stable and support muscle health. Healthy fats from nuts, seeds, olive oil, and avocados improve insulin sensitivity and keep you full for longer. Fruits can be eaten in moderation, especially low glycemic options like apples, berries, pears, and citrus fruits. Portion control is key, as even healthy foods can raise blood sugar if eaten in excess. Lifestyle changes that make a real difference. Regular physical activity is one of the most powerful tools for managing diabetes. Exercise helps muscles use glucose more effectively and lowers blood sugar naturally. Even simple activities like brisk walking for 30 minutes a day can make a significant difference. Maintaining a healthy body weight, managing stress, getting enough sleep, and regularly monitoring blood sugar levels are all essential parts of diabetes management. With proper knowledge, discipline, and consistency, diabetes can be controlled, complications can be prevented, and a healthy, active life is absolutely possible. You're watching Medical Truths with Dr. Nimra, where complex medical topics are explained in simple language, so you can understand your body, your health, and your choices better.